Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. And before I start, I'd like to acknowledge that we're on Mi'kma'ki, the traditional territory of the Mi'kmaq people. I, along with all Nova Scotians, were devastated to hear of the news of the 215 children found buried on the grounds of the Kamloops Residential School in British Columbia. This is a horrific reminder of the damaging legacy of residential schools, including in our province. We, all of us, need to learn from this and to all of the survivals of residential schools across the country, their families, the Mi'kmaq here in Mi'kma'ki, and to all Indigenous peoples, we mourn with you. And as you know, our flags have been put to half-mast across the province at all provincial buildings, including the legislature, for 215 hours. That in itself is definitely not enough. The ongoing impact of intergenerational trauma endures, and we need to help heal these wounds in the spirit of reconciliation. I'd like to also report that we have, unfortunately, one death to report due to COVID, and my condolences go to the family. We also had, unfortunately, 4 reported on Saturday and another one on just yesterday on Sunday. So we have a total of 6 deaths again reported in the province over the weekend into today, and on behalf of all Nova Scotians, our hearts are with the families and the friends of the people that lost their life due to COVID. Today we are reporting 17 new cases of COVID in our province. All of them are in the central zone, but 3 of those are connected to close contacts. But our cases in central have dropped significantly, and I'm happy to report that we have 0 cases reported in the Sydney area today. I want to thank everyone for working so hard to get our case numbers down. We are the envy of so many jurisdictions across the country, and it's all because of the hard work of Nova Scotians. You stayed close to home and you followed the restrictions. You worked hard, and now we have a good result, so thank you. We told you last Friday we needed a couple more days to determine what's going to happen with schools in the Sydney and HRM area. We needed to assess our case numbers and what we were seeing in those communities. In Sydney, as I said, we have no new cases. We were able to contain the spread of the virus, and things in that community are looking very good. There were over 8,000 asymptomatic rapid tests that were conducted over the weekend in the Halifax area, and this is when we may have expected to see a spike in some of the COVID cases a week after the May long weekend. But out of those 8,000 tests, only 3 came back positive. That means we have a 0.03% positivity in Central Zone. Add to that, we continue to see large uptake of our vaccination program of all ages. With all of this information, Public Health has confirmed that our epidemiology clarifies that schools in Sydney and HRM are also safe to open this week. Students will go back on Thursday in those areas. The system needs that extra day to get ready to safely reopen. We're also working on a testing strategy for our schools, but feel the best place for kids is learning in the classroom with their friends and their teachers. And I want to thank teachers and all support staff and parents for all that they're doing to work so hard to get their kids ready, and over the last month doing that learning inside the home environment. I want to thank our students for working hard to stay connected to their education. And this week will be exciting for all of you to reunite with your friends and to your teachers in person. But please remember to follow the public health protocols and put safety first. We also told you last week we needed a little more time to look at the travel that's going in and out of Halifax and Sydney. I'm glad we took a few days to review the case numbers and the results of our testing and the strength of our vaccine program, which depends on supply. We will put 58,000 shots into arms this week and 75,000 booked for the next week. We're on track to giving everyone in the province who is eligible their first dose by mid-June. And many Nova Scotians will actually start receiving emails within a day for their second dose appointments. And Dr. Strang and I have talked throughout the weekend into today, and based on his advice and all these factors, effective Tuesday, you can start to travel throughout our entire province. That does mean you can go see loved ones and friends, but please stay outside right now. It is important that we take this cautious approach and limit socialization as we slowly open up. You will soon be able to see people inside in phase 2, which Dr. Strang and I are both comfortable is on track for about 2 weeks. You can go to your favorite park or go for a hike or go fishing. And I encourage you to explore this beautiful province and buy local. Just be mindful that if you have one shot of vaccine, you aren't as protected as you need to be against some of these variants especially. So please follow the current restrictions and continue to follow the public health protocols. And before I hand it over to Dr. Strang, some good news to report for our vaccine rollout in the long-term care homes. We have all of them receiving their second dose now. That's everyone in public and private, and our residential care, rehabilitation centers, and our veterans in long-term care. So thanks to everyone involved in delivering those vaccines and those that received them. We are certainly getting there quickly. Dr. Strang.
Thank you, Premier, and good afternoon, everyone. I, too, want to acknowledge the families who are grieving after this weekend and offer them my sincere condolences. I also want to recognize the 215 Indigenous children who were buried in a mass grave at the Kamloops Residential School, and acknowledge that this is part of a bigger tragedy that we as a country need to recognize and deal with. There was a lot of difficult news this weekend. Our case numbers do continue to decline, however, but I fully expect we will continue to see some cases in the weeks ahead, and that's okay. Vaccines allow us to tolerate some level of ongoing circulation of the COVID virus. Overall, we are trending in the right direction. Cases and hospitalizations are declining, testing is steady, and our vaccine coverage is rapidly increasing. Given how quickly things are improving, faster than I expected 2 or 3 weeks ago even, I am pleased to say that at this point of reopening, we no longer need to restrict travel within Nova Scotia. People can go to their cottages, go fishing or hike a trail in another municipality, or even visit family. You must, however, follow the restrictions on indoor and outdoor gatherings. As the Premier has said, as we opened on Wednesday, it's small groups up to 10 outdoors for this first phase. The improvement over the last several days also means that all students and teachers can safely be back in the classroom. Schools in HRM in Sydney will return on Thursday, and all other schools will return on Wednesday. There has been some uncertainty around schools. I'll acknowledge that over these last few weeks, and I want to thank parents, teachers, and students for being flexible and for working hard all year to keep schools safe. Whenever possible, in-school learning is preferred, and it's great that students will finish out the year with their friends and classmates. On Friday, we introduced our plan to safely reopen our province. And the reviews are mixed. Some are comfortable with our cautious approach, and some feel like it doesn't reward them for the hard work they've done. I understand, however, I feel that we have an appropriate balance of those two perspectives. And if you remember one thing I say today, let it be this. Have faith. Better days are ahead. We will get to the end of this more quickly than you think, but we still have to remain cautious. To the businesses and other sectors who are anxious for more detail around future phases and what it means for them, it is coming very soon. We know you need to plan, and we'll provide as much certainty as we can in this very uncertain time. As a reminder to folks, our plan has 5 phases starting this Wednesday with Phase 1. And it will end with Phase 5, likely in early September, once 75% of Nova Scotians have received 2 doses of vaccine. That's when we'll have the most protection from the virus and its variants. While vaccine is effective against most variants, there are some, and specifically the variant that is first originated in India, where the evidence is showing that it takes 2 doses to get good protection from this illness. Once Nova Scotians are fully vaccinated, we won't need to rely nearly as much on public health measures and restrictions. And I expect things like masking and distancing will be optional, not mandatory, and that we'll be able to travel much more freely. However, until then, we need all the layers of protection from one vaccine dose, regular testing, and some level of public health measures and restrictions. So we're being cautious. We're moving slowly but steadily because we do not want to move backwards. Once we're open, we want to stay open. Each phase is between 2 to 4 weeks long. Given what I'm seeing now and Nova Scotians' commitment to getting through this, I expect we'll be able to move through the phases in 2 weeks, which means we could be in phase 4 by the middle of July, which is where we would stay for the rest of the summer. Once we reach phase 4, friends, families, and tourists from Atlantic Canada can come to our province and we can go to theirs. Canadian travelers from outside Atlantic Canada can enter, and we may be able to consider modified quarantine based on vaccine status, border testing, and the epidemiology in other provinces. We will be able to gather inside our household with 25 family and friends with no distancing, and up to 50 people outdoors. We'll be able to attend a gathering hosted by a recognized business or organization, including faith groups, with 150 people indoors and 250 people outdoors. Our stores, restaurants, bars, and services will be open at maximum possible capacity with public health measures. Sports and professional and amateur arts and culture groups can have will be able to have 50 participants with no distancing or masks for practices, games, league play, rehearsals, and in-person performances. And there will be able to be spectators and an audience. But to get all these things in the shortest possible time, we need to keep doing what we've been doing, following whatever the level of restrictions are at the time are required, getting tested and getting vaccinated. I need to remind people that testing remains incredibly important as we reopen. Workers and students should get tested regularly as they head back to workplaces and schools. Now I'd like to address a few common questions that have come up over the weekend about our reopening plan. The first question is, why are we reopening so slowly when we're getting vaccinated? Sadly, the deaths reported over the weekend are a stark reminder of how important it is to go slowly. The virus is still here, and while 51% of Nova Scotians have one dose at the end of the day yesterday, one dose of vaccine, that is not enough protection to completely relax the restrictions and the public health measures that have kept us safe for the last 15 months. Dr. Theresa Tam, Canada's Chief Public Health Officer, has urged all provinces and territories to maintain restrictions until 3/4 of the eligible population has a first dose and 20% have a second dose. And she issued a word of warning on the weekend asking provinces and territories not to go too fast in their reopening. If public health measures are relaxed and contacts increased, a resurgence of COVID-19 is highly likely, in her words. Reopening too quickly could lead to another wave. And so in Nova Scotia, we'll do everything we can to avoid that. Our experience has shown what can be achieved through quick action to address outbreaks, paired with a slow and steady approach to reopening. That has gotten us worldwide recognition, and we're not going to deviate from that plan now. Another common question is why we need to wait 2 weeks before moving into the next phase. Simply because the incubation period of this virus is for 2 weeks. So we need that time to see the impact of each phase. And the last common question I want to address is, why can I eat on a patio with 10 people, but I can't go to my grandparents' house for supper? And that's simply because in this first phase, we need to be focused on outdoors and keeping gatherings small. Within the restrictions starting Wednesday, you could go visit your grandparents, but it would have to be outdoors, and it would have to be no more than 10 people. So outdoors and small groups is the key. And then gathering limits, both indoors and outdoors, will slowly increase as we move through each phase. So in closing, I do want to assure Nova Scotians that visits and hugs with loved ones are coming. Barbecues and family birthday parties are coming. Visits with family in Atlantic Canada is coming. Watching a live theater performance or your kid's soccer game is coming. We've asked a lot of everyone, more than I have ever imagined when all this started last March, and you have responded. So I know we can do this. We've gone 15 months and we're only a few weeks away from summer together. We just need to stick with it a bit longer. So stay strong, stay together, stay with us, please. We are so close.
Thanks, Dr. Strang. Oh, go ahead, Premier.
I misspoke there. Actually, there was 5 deaths in total over the weekend. There was no deaths reported today, so that's my bad. Sorry about that.
Thanks, Premier. Again, just a reminder, we'll take one question, one follow-up from reporters on the phone in the allotted time that we have for today's briefing. We'll start with Jesse Thomas from Global. Go ahead, Jesse.
Thanks, Tina. My question is regarding the decision to open schools. I know there's going to be a lot of parents that are perhaps scared, but even students who might be scared now. We saw it during, the days in early April where there was, cases being linked to schools and children and families being impacted. I'm just wondering what the rationale was to change today from Friday. I know you referenced a 0.3 positivity rate in the Central Zone based on rapid testing over the weekend, but what's the decision to change abruptly today and reopen schools this week in HRM and Sydney?
So it's 0.03. That's extremely low, and those are a good sample size of tests that we looked at. But we were close to being able to decide on Friday, and I wanted another few days to look to ensure that the low level of case activity continued. We do see a pattern of keeping our cases low, and the cases are 0 in Sydney today, and public health was comfortable. And we've said we've been trying to keep kids in school if it's at all possible. So that's where I believe we're at today.
We've said from the beginning, since classes went back in September, that our schools are a safe place, but they are safe because when our communities are safe, and by and large, we've been able to keep our schools open. During this third wave, we had enough spread in communities that we had to close down schools for a period of time, but that situation has come under control faster than I even imagined. So we're back to a place where our schools are safe. We have good protocols. But what makes them really safe is we have really no indication of general community spread anywhere in the province. There's some little bits of spread within HRM, but mostly in confined populations. So I'm very comfortable giving the recommendation to the Premier. I want to assure students and teachers that I look at this very carefully, and I am extremely comfortable to say that our schools are as safe right now as they have been through most of the past year, and I'm glad that we're able to get students and teachers back into school for June.
Go ahead, Jesse, with your follow-up.
Well, thank you. Just on a follow-up, the Nova Scotia Teachers Union sent out a release just before this press briefing today, calling on the government, Premier, to essentially to open up a full and transparent review of school COVID-19 cases. They're saying they believe that essentially there's maybe more cases in the schools than we were led on to believe. I'm just wondering if you can comment. Is it important to look at something like this, a full maybe review of the COVID-19 cases in schools?
So, like Dr. Strang just said, when you have significant cases in communities, then people that work in schools are part of the community that have cases. So we're transparent all the way through our waves to report when we have cases identified with people that work in schools, and we continue to be transparent with what's happening. I have confidence in the education system and the protocols they have in place. We've followed those protocols. We went to online learning when we had the escalation of cases, and our cases are back under control. We're seeing our 17 cases today. We've seen a number of days in a row with low case numbers being reported, and so we're comfortable with where we're going now.
Maybe I'll add again a bit more detail. And we've looked at all the cases in schools. We know that even during the third wave, we had significant numbers of people, both teachers and students, who were attending school while they were infectious. Almost all of them were exposed outside of the school setting. We had a very small number of classrooms where there was some secondary transmission within the classroom, and we had no schools where there were cases of COVID where we had wide outbreaks in a school. So even during the third wave, the majority of our cases did not result in any transmission in the school. We had a small number of classrooms where they did. So even during the third wave, we were able to maintain with our protocols a high level of safety within schools, and that was in the context of having wide community transmission. Now we're back to a place where we really have little to no community transmission, even in HRM, and none elsewhere. Our schools remain extremely safe.
Next, we'll go to Carolyn Ray from CBC. Go ahead, Carolyn.
Yeah, I'm wondering, we're hearing from a number of teachers who say they've even started to disassemble their classrooms, and logistically, they assumed that the school year was over because they were told the school year was over in person. So I'm just wondering, logistically, are you giving teachers enough notice, and why haven't they been warned that this is coming?
Well, we let everybody know at the same time publicly. Obviously, if we tell people in advance, then the decision's made at that point. So we continue to make the decisions based on the epidemiology out there, and the Department of Education said they need until Thursday. So now is Monday, and we have a number of days to get prepared to be ready, and the rest of the province are prepared for Wednesday. And again, it's really important. I don't want to discount the importance of having students in school. It's clearly safe to have kids in school right now, and that's where they should be.
Go ahead with your follow-up, Carolyn.
And Premier, I'm just wondering, in regards to the Atlantic bubble, have there been any discussions among the other premiers to coordinate this? Because we're seeing the plans from each province are quite different this time. I'm wondering why there hasn't been sort of a unified announcement or unified plan at this stage.
I referenced this in the last briefing that we had our regular meeting of the premiers in Atlantic, and before that meeting, one province had already determined the date. We experienced a significant third wave that we're just coming down from, and we're looking at how we best approach what phase that the opening could look at removing the isolation period for Atlantic Canadians. We're all around the same time. If you look at our phases, it's late June. So I think it's June 30th around the time that we'll be approaching our third phase if all goes well. So that's really close to the 27th time that PEI has referenced. So we're all around the same date, but just because one province determines that that's the direction they're going in doesn't mean that we need to.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, just on the Atlantic bubble, can you explain a bit more how it may work, especially if New Brunswick lets people from outside of Atlantic Canada and even Maine into its province by July 1st? And on that, if the Atlantic bubble does open, are people required to have vaccines in order to enter Nova Scotia?
And your points are just a continuation of what I was just referencing. So every province is different and looking at different plans to reopen beyond the Atlantic region. So if they do that, then it's no longer a bubble. We'll continue to look at policy that's best to keep our people safe, and that we consider our own epidemiology, but what they're doing. So we, at this point, aren't requiring vaccinations, but we also know that New Brunswick and PEI are roughly on the same track of vaccination uptakes as us. So that makes it more comfortable to look at a rough timeline of when we'll introduce that. But of course, if a province, whether it's New Brunswick or any other province, relaxes their borders beyond that, then we'll have to consider that with our plans.
Go ahead, Natasha, with your follow-up.
Thank you. Dr. Strang, I'm wondering whether or not you may be able to speak today to whether those who died in the third wave were in fact vaccinated.
So we'll have some data. We're going to start producing a weekly data on what we call breakthrough cases. So we'll have more to this. We have to bring that forward first in the Premier's office, and we'll have more data later this week on, in total, during our third wave, cases, both general cases, hospitalized, and deaths that would have been vaccinated either with 1 dose or 2 doses. But I will make the comment that we will see some. As I've said over the last week, we fully expect the vaccine is not 100% effective, even 2 doses. So we fully expect that some people, even with 2 doses, are going to get sick, and some people may die. That doesn't mean the vaccine is not working. The vaccine works at a population level as well. But we will have more to say on this, but I just want to make that point because some people are looking at us and using it as a way to say, well, the vaccine doesn't work. That is completely wrong. And the other point is, as we get our number of hospitalizations and deaths and number of cases will continue to decrease. But as we get a greater percentage of the population that is immunized, inherently with those overall small number of cases, a growing proportion of those will be in people that have had 1 or 2 doses of vaccine. Again, that's completely expected and should not in any way be interpreted that the vaccine is not working.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yeah, good afternoon, Dr. Strang. Ontario resumed the use of the AstraZeneca vaccine for second doses this past week, and they cited evidence that the likelihood of developing the condition where people develop clots is even lower after the follow-up shot than it is after the first injection. I'm wondering whether, I know that you're waiting for further guidance on this, but what do you think of that? And do you think, is the likelihood growing that you may be able to resume AstraZeneca shots in the province?
We expect to hear, even as early as tomorrow, the results of the recommendations from NACI. I will make the comment that even though it's less with second dose than first dose, the risk of that clotting event is the number is going down as we get more experience, even with second dose. Our approach is going to be based on all this information. We'll revise our informed consent process, and Nova Scotians who choose to want to make a choice, if their first dose was AstraZeneca, and if they want to make a choice of AstraZeneca versus one of the mRNA vaccines, we'll give them clear information so they can make an informed choice.
Go ahead, Keith, with your follow-up.
This is for Premier Rankin. It's for a colleague. Today, as you know, the affordable housing report came down. I've been asked to ask you if you're committed to finding the $25 million the report calls for in the next 100 days to help 600 to 900 households find suitable, low-cost housing. Your housing minister has told reporters that he'll bring the request to cabinet. Is this something you can support?
Conceptually, it sounds like the advice from the commission aligns with where I think we need to go. We do need to find a way to incentivize more supply. That's the core issue with housing in our province. So we need to find a way to encourage more affordable housing units in the for-profit, but also the nonprofit sector as well. So we're going to continue to find ways to do that, and that might be the range, the order of magnitude that we're looking to invest. So I'll look forward to the presentation that the minister brings forward to cabinet.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. So we have 40 people in the hospital. I was wondering if, Dr. Strang, you have an estimate of how many people are getting medical care for COVID at home?
I don't have numbers. We do know that with all our new cases, we have a virtual care program that people are monitored. They're provided with pulse oximeters, and they're regularly monitored by the virtual care team and given additional supports in whether it's at home. But if they really require oxygen, which is often the initial sign they're getting into more seriously ill, that means they have to come into hospital.
Go ahead, Nabal, with your follow-up.
Thank you. I also wanted to ask you, Dr. Strang, I realize that we've cleared the contact tracing backlog a long time ago. So I'm wondering, how long is it taking now between finding a positive case and completing contact tracing?
Well, we initiate. We're back where once the positive case goes through our electronic system and public health becomes aware that the investigation is started within 24 hours. Some investigations are fairly straightforward. Others are very complex. So there's no kind of set time by which we say the investigation's done. It depends on the complexity of the investigation, but certainly we're back and have been for a couple of weeks at least, starting those investigations within that 24-hour window of public health being notified.
Next, we'll go to Adrien Blanc, Radio Canada. Go ahead, Adrian.
Thank you. Last week you mentioned implementing rapid testing in Halifax International Airport. Where are we at, and when will it be put in place?
So we're still on track and finalizing some of the details. As we said last week, we're expect we'll be able to begin that by June 14th.
Go ahead with your follow-up, Adrian.
And about schools, either Dr. Strang or Premier Rankin, are you concerned that this back and forth between virtual and in-person learning is going to be detrimental to the students' education?
No, I'm not concerned. I think that the online model was prepared well, and a lot of children were able to access it, but you can't replace that in-class learning environment and being able to engage with your peers. And I think that a lot of the children are looking forward, I would think, to get back into the classroom and see their teachers now that it's safe to do so.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Hi, Premier. You've touched on this, but I'm hoping for a bit more detail, specifically in the discrepancies between our plan and New Brunswick's in terms of reopening for travel. Do you plan to work further with Premier Higgs to refine this so that potentially travel dates will match up more closely? And if not, how do you see this working?
So the premiers do talk in between our regular meetings, and we said we'll continue to have that discussion as we look at the month of June. We'll have that discussion again. So you mentioned Premier Higgs, so that's New Brunswick. New Brunswick and PEI both have different plans themselves, but we're all around the same range of when we think that it's the right time to look at removing this self-isolation period. So I think that we'll continue to have that discussion and land around the same date.
I have weekly calls with my Atlantic Chief MOH colleagues. We have one later today, and that I put that on the agenda. That's a key topic for us to be discussing consistency and bringing forward recommendations to the Premier's group.
Go ahead, Lindsay, with your follow-up.
Thank you for that. Something, Premier, that isn't in our reopening plan is a reuniting families policy like PEI has, which is prior to border opening and allows for family reconnection. Are you considering a compassionate reunification clause like PEI has?
We haven't looked at that specific reunification. I know there's challenges around rotational workers that we specifically are looking at. I think we could become more flexible once people have 2 doses of vaccine because of the reasons that Dr. Strang went over, the variants of concern. When you have 1 dose, they're not nearly as effective as 2 doses. So that's our biggest challenge when we make exceptions for travelers coming into our province. We have very strict measures at our border that we have in place for the next period of time as we start to slowly open up, but I'll certainly take that problem back for those that are trying to get into our province and see where we're at with that.
And I'll add, we do have, for extreme circumstances, we do have a compassionate exception stream that families and individuals can put their case forward, and we're always cautious, but we do have an ability under, I guess, very unique and specific circumstances where we could work with families around allowing them to be reunited.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. I'm wondering if either of you could speak to the situation at the non-COVID ward at the Halifax Infirmary. There was a obituary recently. And it was stated that the deceased was one of those people. Do you have a death count for the people on that non-COVID ward who contracted COVID?
That is one of the deaths we announced, and when we announced it, we did acknowledge it was from that part of the outbreak. As far as I'm aware, there's been one death from patients who were on that or initially exposed on that non-COVID unit.
Go ahead, Tim, with your follow-up.
Yeah, so there's confusion around whether there's community spread, to what extent in HRM. Will you get back to reporting the source of infection, whether it's close contact, travel-related, or unknown, so that we can assess that? There's only 17 cases. That we understand why you stopped doing that when there was lots, but with the lower number, can we return to that?
We'll take that back and look at that with the EPI group.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. This is a question for the Premier, I guess. I'm wondering, after the findings late last week in Kamloops at the former residential school, as Premier and Officer of La New Affairs here in the province, I know you made some tweets over the weekend. We're lowering flags in the province, and there was, I think, the first land acknowledgement I've ever heard you make at the beginning of this speech. But I'm wondering if you're putting some actual money in behind reconciliation, looking into the land at residential schools here in the province, putting some funding into helping other Indigenous groups look into those findings.
Yeah, so there's a lot there in that question, and respectfully, I do acknowledge the land that we're on, the unceded and traditional territory of the Mi'kmaq people, whenever I deliver a speech. But I will say that this is a priority, reconciliation, and our growing partnerships with the Mi'kmaq here in our province. We've made some strides forward in closing Boat Harbour and bringing treaty education in schools and continuing on many different initiatives, but it's not nearly enough. Just because I'm lowering the flags and one of the first provinces to come out and do that doesn't mean that it stops there. Reconciliation is a journey, and one that I'm committed to as the Premier of this province. We'll continue to find ways to work together. And on the situation of the burial grounds, that was one of the questions that I specifically asked too, and what's happening in Shubenacadie. So I know that Parks Canada has been doing some work there since 2019, doing some survey work for the archaeological study. We'll continue. We are a partner in that work alongside KMKNO, and we'll continue to be a partner in the work that they're doing there.
Go ahead, Victoria, with your follow-up.
Okay, thanks for that, Premier. And Dr. Strang, I'm wondering if you can talk any more at this point. You've previously talked about the vaccines potentially becoming an annual thing, and as we're seeing more new variants, have you learned anything else about that, and whether we could even see a fourth wave here? Some other provinces are talking about whether they should expect a fourth wave as COVID continues to change.
So we continue to follow the evolution of variants and the science around about what the longer term future might be around the vaccination. There's nothing I can share differently than from last week. That's going to take some time. We're focused on getting through phase 1 and phase 2, and I think the way we avoid, at least in the short term, a fourth wave is by being cautious, making sure that we don't advance further than is safe, knowing that there's variants out there, and we have one of the variants that needs 2 doses of vaccine to give good protection. That is how we avoid the fourth wave, and then we'll wait for the evolving science about what the long-term future it'll be about. I fully expect that this COVID virus is not going to go away completely. We'll have to keep it controlled with vaccine, and what the future holds with vaccine, we'll have to wait and see what the science tells us. But it does mean that I see, we'll have, whether it's flu or COVID or something else, that some of the things we've learned, mask wearing and increased hand washing, being careful about how groups we get together, especially indoors in the wintertime, all of those are some things that we need to think about how we adopt those more in our regular life, not requiring them to be mandatory, but as good personal practices moving forward.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question is for Premier Rankin. As schools reopen, I'm hearing that many of those with cafeterias won't have any stock to feed the kids. They sent that home. They sent all the food home to families or giving it to the food bank, including all the milk. So what is the province going to do to ensure those kids get food now that schools are opening?
Thanks for that question. We'll bring that back to the. I'll contact the Minister of Education myself to see what the plans are as they look to reopen Wednesday and Thursday. We do have a good breakfast program that's in place, so hopeful that we'll be able to find local food for them. So I'll take that back. It's a good thing to point out.
Go ahead, Pat, with your follow-up.
Dr. Strang, this question's for you. What's your message to parents who now are scrambling to find daycare for 17 days with schools reopening?
So thanks for the question, Pat. Yeah, I know that there's some challenges certainly in this, but it's also the opportunity of getting kids back in school, which is the best learning environment for them, and it's not insignificant. It's a whole month, 1/10 of their school year. We certainly are, as part of the reopening, we're increasing the capacity of daycares back to 100%, and so hope that will help provide the supports when parents are looking for some childcare.
Next, we'll go to Janet Whitman from Halifax Magazine. Go ahead, Janet.
Hi there. Thanks for taking my questions. I'm wondering about the injunction banning public gatherings and whether there really is a need for such a far-reaching one given the trajectory we're on now.
So, I mean, I think it's still there. We still have bringing large numbers of people together. It can present some risk. We'll continue to look at that. But I think the other purpose of the injunction is to prevent groups that are spreading deliberately spreading false information that can actually create risk. The information itself, if listened to, creates risk to the public as well. So, and that certainly is a need to manage that misinformation campaign as well.
Go ahead, Janet, with your follow-up.
And is the government requesting that the hearing on June 4th with the CCLA be postponed?
I'm not aware of it being postponed. I'll have to get back to you on that one. We'll get you an answer.
Next, we'll go to Preston Mulligan from CBC. Go ahead, Preston.
Hi, thanks. My question, either for the Premier or Dr. Strang, I'm just curious about what it's going to look like at the border in Amherst once we get into phase 3 of the Atlantic bubble phase. There's testing planned. How does the testing work, and what kind of monitoring will be in place for the duration of the summer?
So there certainly haven't been made any decisions one way or another about testing at the land border. We'll have to see as we work through the next few weeks on towards phase 3 and with other provinces around the Atlantic bubble exactly what that will look like.
Go ahead, Preston, with your follow-up.
PEI is planning to take a swab from people as they get off the bridge and then get back to them with the results. Is that on the table? Is that one of the options?
As we're looking at a number of things. PEI's had testing all along. They have a significantly lower volume of traffic, and they also have a more controlled physical environment at the Carleton entrance to PEI. There's a number of substantive logistical challenges that have been identified to us by police and by our border folks about the real safety risks about creating any kind of blockage that would impede the flow of traffic. So we have to be cognizant of that as well as the logistics around any testing that we might need to do. It's not that people aren't being tested. They're tested in many other ways in other locations as they enter the province. So we have to be cognizant about what is feasible and realistic and safe to do at that border entry.
And that's all the reporters we have on the line for today's briefing. Go ahead, Premier.
Thank you. This is a big week for our province. We are reopening. Some might think it's too slow, and some might want us to commit to specific dates. And the dates you are looking for are those minimum 2 weeks between phases. If we work hard and listen to the restrictions Dr. Strang has asked us to we can get there by about mid-July, and we will have significantly gone back to some level of normalcy. I want to do this in a measured way. We have come through a very difficult time in our province. this third wave has proven to be a challenge. We have had record high case numbers. The variants infected all age groups, and we've lost a number of Nova Scotians. That is something I think about every day. How many people are in hospital? How many Nova Scotians are hooked up to ventilators? I worry about each and every citizen of this province, and I want us all to be safe. Our measures are designed to prevent the loss of life, and our reopening is designed to prevent another lockdown. We need our businesses to stay open this time, which is why we aren't opening too quickly. You need to see your loved ones, and we want to ensure that you can all summer. And if our kids can spend even a couple of weeks in class learning in person, catching up, getting extra help, or making that final push to reading on their own, then I want that to happen. Strong public health policy is strong economic policy. Dr. Strang and his team have provided excellent advice. The public health team has done excellent work to getting us where we are today. Tracy Barbrick and her team rolling out the vaccination program, surpassing other provinces, has done very excellent work. Dr. Lisa Barrett and her team continue to drive the testing strategy across the province, which is the envy of the country. We have to open ourselves up at some point, even with COVID in our midst. We just have to do it carefully, cautiously. We have to continue to monitor these latest restrictions and always follow the public health guidelines. I'm so proud of this province and grateful for your hard work in helping us to get there. Let's keep working together to contain this virus. We need to keep those cases down, and as our vaccine program ramps up. I want to extend my best to all of you and thank you for your support and your love of this province so we can get through this together.